My name is Eszter Hardi, and my vision as a PhD student is to improve the life quality of patients undergoing oral surgeries, and my mission is to find the best solution that alleviates patients' complaints after the third molar removal. To achieve these are my current specific goals. I am investigating the effect of the twin mix and the kinesiology tape and the different flap designs on postoperative complications after third molar removal. My first project is about the effect of perineural twin mix injection in reducing postoperative complications in lower third molar removal, which is a systematic review and a meta-analysis. Why is it important? Impacted lower third molar is found in 90% of the general population, and about 85% of third molars will eventually need to be removed. And after the surgery, in the first 7 days, patients have trismus, swelling, and pain. And how can we reduce these symptoms? Well, twin mix anesthesia is a novel technique for mandibular anesthesia. Twin mix contains local anesthetic solution and dexamethasone. How it works? Addition of dexamethasone decreases leukotrienes and prostaglandins and increases the pH. So the twin mix increases the pain and shortens onset and prolongs the duration of anesthesia. So my aim is to assess whether pain, swelling, and trismus following surgical removal of the third molar can be reduced by perineural twin mix injection. I compared the twin mix anesthesia and the conventional anesthetic solution. My primary outcomes are the swelling and the trismus, and my secondary outcomes are the postoperative pain, the pain score, a local anesthetic injection, and the duration of soft tissue anesthesia and the latency of anesthesia. I did a systematic search in the main 3 databases, and after, with this final search key, and after the selection, I have 8 eligible full text. So now I'm working on the manuscript, and in total I have 14 figures, but due to the time constraints, I like to present only my main 3 outcomes today. My first 3 figures are investigating the effect of perineural twin mix injection in reducing postoperative facial swelling on the first, third, and on the 7th day. The facial swelling is one of the most important outcomes because it affects both the trismus and the pain. The average edema is around 20 millimeter, and in this case, the swelling is obtained by subtracting the postoperative condition from the preoperative condition in millimeter. On the first 2 figures, we can see that the heterogeneity is quite high. It's more than 90%. The explanation for this is the different patient characteristic, and the other reason can be the subgrouping, because the facial swelling was measured on different face lines, and based on this we made subgroups. On the first day, the pooled effect size is minus 3.51 millimeter. On the third day, the mean difference is minus 4.64 millimeter, and on the 7th day, it's minus 0.58 millimeter. And the swelling was reduced on the first and on the third day with 20 and 25%. So we can say that the first day and the third days are clinically relevant, but the 7th day is not. The next 3 figures are investigating the effect of perineural twin mix injection in reducing postoperative trismus on the first, third, and on the 7th day after the surgery. The trismus is also an important outcome because it largely determines the life quality after the surgery. If there is a mouth opening limitation, then the eating, the speaking becomes difficult, and the maximum mouth opening becomes painful due to the muscle tense. In this case, the degree of trismus is obtained by subtracting the postoperative maximum mouth opening from the preoperative maximum mouth opening in millimeter. Here, on these figures, the heterogeneities were quite high because the explanation for this is the different patients' characteristic. On the first day, the mean difference is minus 1.7 millimeter, and only this day is clinically relevant. The other numbers are too small. The next three figures are investigating the effect of perineural twin-mix injection in reducing postoperative pain on the first, third, and on the seventh day. The pain is also a very important outcome because it largely determines the life quality after the surgery. The pain was measured on these 10 points visual analog scale, and the heterogeneities are quite high because the pain is a subjective feeling. So on the first day, the mean difference is minus 1.07, and on the third day, it's 0.62 point. So we can say that these days are clinically relevant. The strength of my meta-analysis is that only RCTs were included, and the analyses were performed at multiple time points, and the limitation of my meta-analysis is that not the same references was used in case of swelling. So in conclusion, the twin-mix reduces the patient's swelling, pain, and trismus in the first 7 days, but no longer gives a better clinical result on the 7th day. The twin-mix shortens the latency and prolongs the duration of the anesthesia. So the twin-mix is really useful because we should not use additional injection. The twin-mix contains low amount of steroids, so there is no complications. And how I mentioned, the twin-mix gives shorter latency and longer duration of anesthesia, which means a more favorable operating conditions for the doctor, and the cost is low. And the implication for research is that we should make more studies for better evidence and follow up on each day and use standardized measurement points. And we should include patients who have similar patient's characteristic. And here you can see my manuscript status. So now I'm working on the manuscript, and my plan is to finish the manuscript by April. And my second project is about the effect of kinesiotape as an adjunct therapy in reducing postoperative complication in third molar removal, which is a randomized controlled trial. So how I mentioned, after the third molar removal, patients have trismus, pain, and swelling in the first 7 days. And with this current treatment, the postoperative complications are still present. So how can we reduce these symptoms? After the surgery, we always suggest the cryotherapy because it produces vasoconstrictions and controls bleeding. And in addition, a new technique appeared, which is the kinesiology tape treatment. It leads to the activation of mechanoreceptors by causing pressure, improving blood and lymph circulation. So my aim is to assess whether pain, swelling, and trismus following surgical removal of the third molar can be reduced by kinesiology tape. In this trial, I will compare the kinesiology tape with different tensions after the third molar removal. And my hypothesis is that kinesiotaping with 40% tension is more effective than other tension and placebo in reducing pain, swelling, and trismus after mandibular third molar removal. So we had the interdisciplinary discussion, and now I started to write down the protocol. So now I'm working on this free project, and my plan is to finish the first project by June, the second project by October, and the third project by December. And I'd like to thank you for your attention with a quote, "A goal without a plan is only a dream."
Hello, thank you very much for your presentation. Regarding your first project, I think it's amazing results, right? Especially in regards of the facial swelling, and all of the results were positive for the twin mix. Did you come across any negative effects, especially in the context of third molar removal?
No, I think it's really useful, and I didn't find any complications when we use it. So I think it has just benefit result.
Thank you.
There is another question there.
So first of all, congratulations. And in the beginning of your presentation, you mentioned, and at the end also, you mentioned that there is 3 ongoing projects, but you only talked about the first 2 projects. So can you please tell me a few words about the third one?
Yes, thank you for your question. Well, yes, the time was really just. So now is the occasion, so now I can mention it. It will be a network meta-analysis, and I am investigating the different flap designs on postoperative complications after the third molar removal, and my primary outcomes will be also the swelling, the trismus, and the pain, and my secondary outcomes will be the periodontal condition, the wound dehiscence, operating time, and that's all. Thank you.
Were you dealing with the surgeon's experience? Because the flap design is one option, but how do you handle the flap? How do you operate? How was the impaction rate? What was the angulation of the tooth, and so on? How much bone you had to remove, and so on and so on?
Yes, I would like to include wisdom tooth, which is in one category. So, for example, which is in according to the Gregory classification, class B level 2. So it's the same,
I'm sure you are going to mention it in your paper.
Yes, of course.
And
yes,
then
of course.
don't forget to mention it next time when you give the presentation about your data.
Thank you for your
And there was a question as well, please. A microphone to this handsome guy.
Yes, go ahead.
Thank you. Great presentation. My question is regarding your first project. I would like to ask if this twin injection is used in the clinical setting already in Hungary in your practice, and whether it is used in any other procedures.
For the second part, yes, we can use it for other surgeries as well, and for the first part, we use dexamethasone injections in different ways. For example, we can inject it to the submucosa, something like that. I don't know that we mix. Maybe I don't have any information about it. But the dexamethasone, yes, we use it in that.
So it was a great presentation. My question is about the second project. So how could you actually measure the tension between the different kinesiotapes?
Yes, we can measure this distance, and then we will reduce this distance, and then we will apply this kinesiology tape. Is it clear? Okay.